Good afternoon, Final Road Surgery. How can I help? So, what's your date of birth, please?
How can I help?
If I'm honest, the symptoms that I feel now are kind of like symptoms that I felt when I had cancer.
Is it possible for him to reduce the volume? Sorry, just 5 minutes. You can do it on the lower. Oh.
Is it both sides or just this side?
And you can keep my picture.
Yeah.
And this may be worth a fortune, you never know.
You never know.
Oh, the cream's worked then, has it? Oh, good.
What you call lovely jubbly.
Excellent.
Is it OK if I examine your tummy?
What now?
Yeah.
No,
And can we
yeah.
do a back passage examination as well?
Oh my goodness.
I don't know what you're doing there. Look at the face. Wow.
Lexi, come through. Come in, come and take a seat. Hi.
Right.
Right, how can I help?
I thought she might have thrush, but the doctor said she might have a urine infection as well.
Okay.
So
So did you bring a urine sample in?
I did.
Lovely.
It's happened in the past before. She's fine during the day, but then at night she starts really screaming and crying. It's hurting down below.
Yeah.
Really?
Yeah.
Okay.
So we didn't know what it was.
Okay, and in the last 2 nights she was saying this,
it's
and when
both.
you look down below, Mum, is there anything that you've noticed?
It's nothing. The inside is a bit red.
Any blisters, spots, anything at all? No.
no.
Okay. So you brought the sample, and what we'll do is we'll dip the sample and...
It's in.
Oh, it's okay.
I put it in that's all I had to put it in.
Just don't drink it.
No.
Mummy.
Yes.
It's like, wait.
Hey, it is. It's yours.
Is it her first morning one?
First weed.
Yeah, this is the wee.
Yeah, it was.
This morning.
Yeah.
It's my week.
Is it? No, there's no infection, so the's no blood. What I'll do is, can we have an examination? Is that possible?
Right, you're going to lay on the bed?
We'll just slowly have a look and just look. Is that okay? Do you want to come behind the curtain with her, Mum? Do you want to pop her on here for me?
Whoosh!
Can I take a seat? What can I do for Logan?
Right, well, we saw the doctor this morning about his, closed, droopy eye, and we were told if there was anything else to come back. He said he's getting a bit of blurred vision and double vision in that eye.
Look at me, Logan. No, not your game. Just look at me.
Let me hold that for a minute.
No, don't you.
I won't play it.
Where do you think it's droopy? A little bit full, isn't it? More than droopy, I would
Yeah,
think. It's like the lid's almost a bit swollen.
Yeah.
It is not.
Is it not?
Doctor, felt and she couldn't obviously feel
Thank
anything.
you.
Hang on.
Logan, will you do a few things for me?
No.
It's
you'll
on.
unpause it.
It won't. It'll be fine.
You do a few things for me, Logan. Copy what I do. Screw your eyes up as tight as you can. Really, really tight. OK, and open. Lift, that's it. Eyebrows right up like that. Fantastic. And down. Blow your cheeks out. Go on. OK. Now, follow my finger with your eye. Is that all OK? Now, this is the tricky one. Is that OK? Any problems with that?
I can even close
You can do it yourself, but did you only ever see one of my finger?
Yeah.
Yeah, OK.
Can I just feel your tummy? Any pain at all? No. So if a urine infection, you'd get pain around here.
Okay.
No, that's fine.
That's good to know.
No, that all looks normal, actually. Okay. But because it's been going on for a while, I think we should try the anti-thrush treatment, because you said you've tried pseudocreme and it's not healthy.
Yeah, it doesn't seem to do much,
yeah.
to be honest.
Stand up for me.
That's it. I'll let you get ready.
Good girl. Right.
So let's give her a tiny bit of the canister cream that we normally use.
Right. We'll sit back up. Oh, there we go. Ah, can you share with me? Oh, thank you.
So just apply it twice a day.
Okay.
And just for 5 to 7 days maximum, like a week. There we go.
Cool. We'll get you some proper cream.
Oh, you're so sweet. Well, nice to meet you, Lexi. Oh.
Say thank you.
Thank you.
It's okay.
Right, come on.
Come on.
All right then. Take care.
Thanks for that, darling.
It's okay.
Right, you're going to say bye.
Bye.
Right, let's go. Thank you very
Bye.
much.
It's okay. Bye.
So you can get a swollen upper eyelid that makes it look like it's drooping because this is bigger in size. And I think that's what we've got going on here,
Right.
rather than the eyelid itself isn't moving properly.
Right,
Because his
okay.
eyelid is moving beautifully. So we give him some eye drops and it will all settle down.
It's not a problem, is it? We don't
What
mind.
are eye drops?
Eye drops are like liquid in a bottle and we drop them into your eye.
Okay.
You can do it or mum can do it. But it's quite difficult to put your own eye drops in, even when you're a grown-up, so I would maybe let mum do it.
Why
It's tricky. I've had eye
Why
drops
don't you just
before.
put it in the shower and then just go...
All right.
Yeah.
Take care.
Thank you very much.
Nice to
What
see
if
you.
it doesn't settle down?
Well, then, no,
Then
we'll
we
have
keep
the.
taking
I
them.
will have the pleasure of seeing you again.
Oh, the lovely pleasure. Hey, come on then.
All right.
Thank you
Do
very
bring him
much.
back if you're worried. Give it till Friday. If it's not
Something
better,
is.
bring him back.
Yeah.
Okay. Bye bye.
you.
Last flu jab, and 7 days, come back and see a nurse after taking these.
By a nurse, what do they need to take your blood pressure or anything?
No, she said to see if the infection has gone. In the ear. And flu injection as well. You know, do it all in one, yeah?
We'll try.
Thank you. Does she look like Amy next door a bit?
Amy? No.
No? You don't think so?
I hope she's not all gone.
Hi, come on in. How can I help?
It's obviously a range of things.
Yeah.
I've had like a really bad cough for over a month now.
Okay.
My chest isn't wheezy, it doesn't hurt when I breathe, I'm not in pain with it. But I get out of breath really quickly, like now. I'm out of breath just from telling you that.
Yeah.
There's a lump or something in my ear. If I'm honest, this is gonna sound really stupid, but the symptoms that I feel now are kind of like the symptoms that I felt when I had cancer. I had trophoblastic disease, and it's just like all the little things, like my mouth started, like the taste of food that I liked.
Yeah.
I'd gone off it, and it's like they're all the symptoms that I had when I had to have chemotherapy, and they found out I had cancerous cells in my lungs.
Okay.
It just seems to be all the same. I feel really drained. Like, I don't feel like a healthy 19-year-old. I feel more like a 60-year-old, if I'm honest.
Yeah.
I just don't know what's wrong with me. I've actually really not been well for quite a while. But the main thing is obviously my chest,
The chest,
my
okay.
ear, and just generally feeling
not
the way I do, yeah.
Okay.
Holly had a rare form of cancer called trophoblastic disease shortly after she fell pregnant. What happened in her pregnancy is that the cells of the placenta and the growing fetus started to multiply abnormally like a cancer. In Holly's case, the cancer had spread to the lungs, and she underwent chemotherapy, which successfully treated the cancer.
If we start with the chest, so you've not had a history of asthma in the past. You've never had to use any inhalers or anything like that.
Blue, I got given a blue pump, but it doesn't work. It
Okay.
doesn't do anything to me.
Okay. And you mentioned your ear. Did you actually feel a lump? Because I mentioned when you spoke to the doctor, there's a lump there.
It's like I can feel a lump in my ear, but I'm not sure whether it's my ear or
Okay.
whether it's swollen, but it's just really sore to touch, and it just feels like it's inflamed.
And do you smoke at the moment?
I do smoke.
Okay, how much a day?
If I'm honest, like 10 to 15 a day.
Okay. Do you want to just take some breaths in and out of your mouth for me?
It's making me go lightheaded.
You all right?
Yeah, I just feel lightheaded from like where I keep breathing in and out
Okay,
a lot.
just breathe normally. Don't worry about taking deep breaths in, okay? And just show me this area on the ear that you mentioned that was...
It's inside my ear.
Any discharge from the ear?
Like, ow.
Is it tender if I'm pressing there?
No, but if you like stick it in the way you did, that hurt.
I know obviously you're worried, given everything that happened in the past, that this might be signs that things are going wrong again. Any patient that's had a history of cancer, especially someone as young as Holly, it's very common to see anxieties later on in life regarding their health. However, in Holly's case, I was quite confident that the cancer that she had was very specifically related to pregnancy and therefore very unlikely to be related to the symptoms she was currently presenting with. When I listened to your chest, it sounded very clear. There aren't any noises there. Like you said, it doesn't sound wheezy.
No. It's just literally of the fact that I get really short of breath really, really quickly.
And there's lots of causes for why someone might become short of breath, and that can even be things like anemia as well.
Okay.
So I think the first thing that we could do is a chest X-ray.
Okay.
Okay. I was thinking of doing some blood tests, and then maybe we can catch up in a week or so once you've had those tests done, and kind of take things, from there. But what we could do is also refer you to our respiratory nurse, because this is the breathlessness. I just wonder whether this potentially could be asthma. The ear, when I looked inside the canal, it looked normal. Sometimes the canals can get a little bit inflamed and you can get sort of an infection in the external canal.
Okay.
There wasn't any obvious evidence of that today, to be honest.
Okay, yeah, no, that's great, thank you.
Is that all right?
Yeah, I really do appreciate it. Yeah.
Okay.
Thank you.
All right, take care.
You too.
Hello.
So I'll cut straight to the chase. I think I know what it is. I slept funny. I'm getting this cramping sensation down my arm. It's like a spasm. It's not a heart attack, it's on that side, but it's just down there. I've slept funny, and gee, you see it stay on my face. I can't even put my neck out, it kills. And I just wonder, I've got cocodamol from what I've been prescribed by the doctors. I shouldn't say it's strong. I haven't slept all night.
Okay.
Oh, if you're going to...
Is it both sides or just this side?
But it's like it goes straight across my body.
And you were fine when you went to bed?
No, 3 days I've had this, but last night I haven't slept. Basically, it's like a spasm.
Yeah, you got a trapped nerve, haven't you?
Oh, is that what you feel?
Yeah, can you do that?
I can do that. That's why I didn't want to bother you.
Can you get it up to your head? Or have you never been able to?
No, I suppose I can. I'll tell you what happens. When I'm laying in bed, say that's my bed, if I put my arm across like that or lay down, it's all right. But my elbow keeps on locking and it gets a bad spasm.
Okay.
Like a proper, and it's like a griping sensation.
All right, Jonathan, you stand up for me.
Yeah, of course.
Need you to do some movements for me. Can you take it backwards?
So that's
all right, forwards.
My arm's shaking nearly.
Yeah. What about up? Oh, you don't like that, right? Okay. What about behind your back like that?
No. Look at what I'm shaking at.
Yeah. Okay, just relax for me.
Why can this always happen to me?
Okay, the whole thing's gone into spasm, hasn't it? Can I have your elbow?
That's all right, but
that's not so bad, is it? It's the shoulder and the neck.
It's not hurt. Hurting's not the right word. It's more aggravating because I'm not sleeping.
So we'll give you some diazepam and some naproxen. Naproxen twice a day with food, diazepam 3 times a day, and that should release the spasm.
Is there anything you can recommend? Not on tablets, but when I'm getting sleep, I need sleep. I'm so stressed.
Well, the diazepam will help you sleep.
Doing a desk job, I'll be alright, won't I?
Yeah, it'll be fine.
Just looking up in the air.
Yeah.
I went away in my work on a work conference and the bed was so hard I didn't get sleep.
Oh dear.
No. Well, thank God for that.
All right, take care, Mr. Roberts. Bye-bye.
My throat's not sore, but see, right down there, on fire.
Oh dear.
So there's a little squirt up here and a little squirt up there, so that you don't get nasty colds. Little tickle. That's it. Good boy. That's it.
Excuse me, just a moment.
Great. Mr. Anwar, please. Hello. Come in.
I have got really sore throat. And it's terribly painful. Like yesterday, I couldn't even speak.
Yeah. That's what I was wondering, because you were prescribed some antibiotics yesterday.
Yeah.
So you've only had less than 24 hours of it. Is it possible for him to reduce the volume on the phone?
Sorry.
Sorry, just 5 minutes. You can do it on a... oh.
Sorry.
No problem. Don't worry. Okay.
Yesterday morning, when I spoke to the doctor, she said, any vomiting? I said, not yet. But I did vomit after, like, you can say, around 10-ish.
Okay.
And that was a yellow fluid. Yellow, thick fluid.
Okay.
I don't know what was that.
Have you been coughing as well?
Oh, yeah.
Yeah. It could be a mixture of sputum. Have you got any pain anywhere?
It's still in there.
Apart from there, like in your stomach?
No.
Can you open your mouth for me?
Ah.
Say, ah.
Ah.
Okay, so I can see there's a lot of white spots and exudate in the back of the throat there. So it looks quite angry, the tonsils. So, in many ways, you're on the right treatment already because you've just started the antibiotic course. So it's been less than 24 hours, so I wouldn't expect it to have suddenly got much better in terms of the infection side. But clearly you're still having symptoms and pain. So I'm just going to tickle the back of your throat. If you open your mouth for me. Yeah? Say ah.
Ah. Ah. Ah.
That's it.
Good one, mate. If you...
No, I've done it. Okay, so I'll send this off. Take the antibiotic course. I'll write down medication that you can try. Whilst you're unwell, make sure you drink plenty of fluids.
That's what they told me yesterday as well.
Eat small amounts. You don't have to have a big meal straight away because your stomach needs to adjust. But if you take any painkillers, particularly this one for your throat, naproxen, take it after food, right? But I am going to give you a tablet to try and settle your stomach. Right? But if you find there's any vomiting of very big sort of brown stuff or any blood, you must seek attention again. You've got a likely infection, and most of the time these can be viruses, but I think with your situation with the pus on the back, which is why I've swabbed it, there could be a bacterial cause for this. Time is what you need to settle. All right?
Thanks, Rob.
And rest. Okay?
Thank you. Thank you
Bye-bye.
very much.
Take care.
Cheers.
Watched 50 Shades last night.
Did you?
I love that film.
I prefer the book because in when I was reading the book, of course, I pictured him very differently.
Yeah.
You know, a little bit more tall, a little bit more buff, kind of, and her completely different. Which now I've gotten used to her kind of thing.
It's a smile when she goes.
Yeah, even the way she bites her lip was supposed to be a little bit more. I know. Never mind.
Michael Troy. Hello, how are you? Nice to see you. Come right in. Just take a seat. Oh, bang. Right, how can I help?
an appointment with you.
I know, it's, well, you know.
You're obviously very busy.
Well, it's not just me, but all doctors. I mean, there are too few doctors in the country and there's too many patients.
They're overworked.
Well, we don't mind being overworked. It's just if we had more doctors would help. So we are under pressure, but on the other hand, we enjoy what we do, but we just wish there was a bigger machine. So how can I help?
Well, I'm very worried about this pain I have. Because when it first happened a year ago, over time you expect it to heal up.
Yes.
This has just got worse and worse and worse. And it's really bad now.
It came on when you were drilling overhead, I remember. So let's look at your bloods. Yeah, so what this test showed was that your hemoglobin was low. Do you eat red meat?
Very little.
You just don't like it? It's not...
I just don't have a desire for it. I like fish.
Yeah. You never had a desire much for red meat?
I used to. Occasionally, if I can get the appetite to eat it, I'll go out and go and get a takeaway curry.
Yes.
But they give me enough to feed about 5 people.
Yeah. So just slip off your shirt and let's have a look at it again.
Yeah.
Right. Just show me where the pain is now.
Right, it's under my shoulder.
Yeah. Yeah.
Now, if I stand up,
yeah.
So I'm doing washing up or something like that, preparing a sandwich, it comes around here.
Were you ever a smoker?
Yeah, I smoke tobacco.
And how much do you smoke?
Not a great deal.
Any pain there at all?
Yeah.
Deep breath. And out. So no pain in the centre in your spine?
No.
Right, just lie flat for me. Yeah. Michael.
Michael had been referred for physiotherapy and he had been on a range of painkillers and also had been on gabapentin, which is a medication that changes the way in which nerves work and which we use for relief of pain.
This is where it is here.
Put out your tongue for me. Okay. Just roll to me slightly.
What's worrying me most is it's getting worse.
Yeah, indeed. Up you come, just dress up.
I was concerned by the level of his pain, the fact that it wasn't responding to anything. And when I saw Michael and his obvious weight loss, I knew that this was probably going to be serious.
I'm a bit worried about it in case it's something else.
What were you thinking about?
Cancer.
Yeah,
But there's no sign of cancer on the male side of my family. Anywhere.
Yeah, but you're a smoker.
Oh, yes.
How many ounces do you smoke?
Not a lot.
Do you roll your own? You do?
Yes. And one cigarette, I'll get about 10 smokes out of it. Because it goes out. I have been thinking about giving it up again.
Well, I'd encourage that.
The only thing is that people don't realise, and I didn't, if you give up smoking, you must also give up eating, because you'll blow up.
Well, you're a long way from that at the moment, Michael.
Yeah.
So I'm going to refer you for further investigations into the pain, and we need to do some blood tests as well on you.
Sure. I'm just wondering if it's possible to get an MRI scan or something.
Well, they'll decide that. GPs aren't permitted to arrange MRI scans. It has to be a consultant, it has to be a hospital here.
I have so many things I want to do as well.
Seriously? Asthma? Phone?
Unfortunately, like I said, there's no...
Still got like 5 hours of work to do.
I'm just taking a note.
How do you feel about that?
Terrible. I'm not even thinking about it.
Pretend I've got a microphone.
Gonna have a bit of
How do you
cake.
feel about that?
terrible.
I'll interview you.
Go on then.
I don't know what to say.
I'd be as worried as you are. So we need to do these tests, and I'll be following them up, and I'm going to refer you into the hospital. Do you need any more medication at the moment?
Yes, please.
Yeah. Mm-hmm. So just the gabapentin and the tramadol, are they the things? Yeah. Okay. So we'll see if these tests bring us any nearer the diagnostic truth, but I'm really unhappy about your continuing to smoke. Whatever is the underlying problem is going to make it worse. So I'd really like you to at least cut down with a view to stopping, because it won't help the present situation.
Michael did not present with a history of chronic obstructive airways disease or COPD. He wasn't talking about breathlessness or cough. He was really talking about pain. And so I wasn't really thinking about all of the other conditions that smoking undoubtedly causes or is associated with. I was really thinking about what could have caused this pain, and was he a smoker? And were the two linked?
So I'll stay in touch with you. We'll get the blood tests, the urine tests, refer you in, and we'll just keep an eye on your weight until we get an answer. Sometimes the answers aren't that easy to get. We've done all the other stuff we should do, and that hasn't yielded any benefit. We now need to take it further.
Sure.
Okay.
So just go to the hospital anytime?
Monday to Friday, so go tomorrow, or even tonight. There's 2 hours left. So between 8 in the morning, 8 in the evening. I'm sorry it's continuing, but there's something going on here that we need to get put our finger on, okay? Yeah, nice to see you, Michael. Yeah.
Pleased about that now. Thank you, Doctor.
Yeah, you take care.
All right.
All the best. Bye now.
Right, so that's Wednesday, 11:10.
Doesn't look red, and I can see your TM at the bottom there.
It's fine, so it's on my jaw and my...
Yeah, because my daughter's got that. Analgesia. That's all she has.
Yeah, because I grind my teeth.
Yeah, and Becky does. She really grinds her teeth.
Yeah.
Watch your feet here.
My ears hurts. I'm gonna check it now, baby. Oh.
Come through. Have a seat. Right, how can I help? Morning.
He does have an ear discharge from his left ear.
Right.
So last time when I visited the doctor, they given me 5 days of amoxiclav, and it subsided with that.
So when did he become unwell? When did this start?
Today morning, you know.
Right.
Today morning he wake up at 2 o'clock and he cried because he has an earache, and I given paracetamol 5 ml, and he slept.
So I did have a quick look before you came in. I know because of the history, he's had to had chemotherapy, I believe.
Yes.
Where is he in terms of treatment at the moment?
Treatment, he finished his chemo last July.
Okay.
So they are they are doing MRI scans every 3 months now.
Yeah.
And it's all clear till now.
That's good. George has had a very eventful life so far. When he was around the age of 3, he was found to have some developmental delay. He was subsequently found to have a tumour that's called a medulloblastoma. This is a cancerous tumour of the brain which affects an area of the brain called the cerebellum.
He wasn't walking, you know, when we were diagnosed with brain tumour. He lost his balance and he was in.
Yeah.
He improved a lot, you know, compared with the stories of other medulloblastoma children.
Sure.
He's a miracle now.
Well, that's good to hear. You must have, obviously, a lot of work for you and
of course,
parents,
there is,
having to do all this.
A lot of hard time, you know.
Okay. He's done remarkably well. He's an extremely resilient child, and his parents have been very patient with all the treatment that he has needed. What time was his paracetamol dose?
At 2 o'clock in the morning.
2 a.m. Any doses since then?
No.
Okay. So, George, I'm going to check your temperature, okay? Yeah. Can I see your hands first? Show me your hands. Great. Oh, you can do high five. Brilliant. That's good. All right. Can I check your neck in the back?
Yeah.
And it's mainly checking for the glands here. Good. All right, I'll have a look in his ear. All right, so I'm going to have a look in your ear now. Is it hurting you?
Yeah.
Which one's hurting you? This is hurting you? No, this won't hurt you. Okay, so this is the one that had discharge.
Yes.
Yeah, so there's kind of mucus coming out.
Yeah.
You can see.
Yeah.
Does this happen often? Or...
Since the chemo, you know, that was the 6 months back, you know, the first time it happened.
With chemotherapy, we always have to take extra caution as the risk of infections can become more complicated as the immune system can be much more ineffective and suppressed. When he was on chemo, did he need many courses of antibiotics?
Lots, yeah.
Just as a precaution, because obviously there might be some resistance to some of the things we could give. Do you mind if we just get a swab from the ear? It's just a small cotton bud.
That's fine.
It won't be painful.
That's fine.
Okay? I should have some in this room. Right, so I'm just going to tickle your ear. That's it. Good boy.
Good boy.
You're a good boy. Okay, good. So I'll give you the prescription. And it's 1 spoon, 5 ml, 3 times a day. Okay? Good. Okay, George? Take care. Bye-bye. Bye.
Okay, thank you. Bye-bye. Bye. No. I'm going to lunch in 5 minutes.
Have a biscuit.
I don't want a biscuit.
We've got raisins in. One of you 5 a day.
One of you 5 a day.
No, one of you 5 a day.
A day. A day.
Oh, how do you say it? Day?
Day. Day?
Day?
You sound so common.
Oh, you love it downstairs?
I know, yeah. They put me all around the place now. You know, change is as good as a holiday.
It is, isn't it?
What do I do for you?
Basically, I took my shoes off yesterday from work.
Yep.
And the ball of my foot,
Yeah.
I went to walk on it.
Yeah.
Can't put hardly any weight on it.
Really?
And by the looks of it, on that side it's all swollen.
So if I press on the bone like that,
Yeah.
you're okay?
It's not too bad. You know when you stretch your muscles, when you're having a stretch.
I do that.
That's when it hurts.
Is that hurting up underneath here?
Yeah.
So if I press in here...
That is hurting.
Okay. I don't have a foot with me,
Yeah, yeah.
but I'll quickly show you what's happening. If I can find a piece of paper. Here we go. So these are your leg bones coming down here. Underneath that, you've got a funny bone like this, and that's where the rest of your foot normally comes off from. And under here is your heel bone sticking out. Okay?
Yeah.
So that's your heel bone there, and these are your toes down here.
Yeah.
To keep, you've got an arch in the foot, haven't you? It's meant to be a bit like that.
Yeah.
And to keep that in place, there's a piece of tissue that runs from just under the bottom of the toes all the way through to there, and it's trying to keep that in a nice curve.
Yeah.
Okay.
Yeah.
Sometimes you do something and it inflames that bit there, gets really sore, and that's where I'm pressing. So I'm pressing right on that, and that kills you.
Yeah.
And it feels like almost like having a stone in your shoe, isn't it? You just think, I can't put that down.
Yeah.
So there's a big name for it called plantar fasciitis, okay? So there are 2 sorts of exercises that you need to do, okay? One of them is to stretch that calf muscle, okay? And that's the one where you put your foot against the wall and you stretch it and stretch it. And you need to do that all the time, okay? And the other one is to get a tennis ball and you put it on the ground.
Sounds silly, but it's not, yeah.
Yeah, and you just roll it underneath that foot just to try, you're sitting down, don't stand up and do it. Okay, you fall over. I'm going to give you an anti-inflammatory just to try and reduce some of that inflammation. But the other thing you can do is if you go to a pharmacy or you can get it online, there are things called sorbethane heel pads, okay? And they're like a gel pad that you put in the shoes, okay? And it cushions that area.
Right,
Okay?
Yeah.
So that's what we're going to do. I'm going to give you the anti-inflammatory.
Yeah.
You do the exercises,
Yeah.
and you see if you can find those. I'll write it down.
No problem.
Sorbethane. And you can keep my picture. Even Van Gogh had to start somewhere, didn't he?
Yeah.
And this may be worth a fortune, you never know.
You never know.
There we go, Jules. Okay.
Thanks very much.
You're welcome.
See you
See you
later.
in a few weeks, yes?
Yeah.
See you later, bye-bye.
Right, I'm going to do an impression of you, okay?
Yeah, go on, do me.
Right, darling. Got an appointment, lovey.
Is that good?
You get me in trouble.
Pauline Hiran? Hi there. Come and have a seat. Hi. How are you?
Yeah, it's still not right.
Okay.
It's not 100% right. I keep sending a letter. They give me, Doctor, I don't know, prescribe them, but he hasn't put them on a repeat prescription. For my tummy, the Lanzaprop.
Okay. How long have you been taking it?
Oh, quite a while now. You know, when it's terrible heartburn, and when it really does get to her, they just are brilliant.
Do you get heartburn every day?
Yes.
You do. Bowel problems?
I have got IBS. I
Okay.
have got, yes, I have got.
Any problems with bleeding when you're opening your bowels?
I've got piles as well, and they bleed sometimes, and sometimes I think it's just my piles.
Okay.
9 times out of
Is
10.
it bright red blood?
Yeah, yeah.
Any
Yeah.
blood mixed in with the poo? Or black poo?
No, I don't really think it's black.
Okay. Is it or not? I don't know what as such means.
I don't really examine it.
No, but you've not seen black poo.
You
would
have said if
you'd
seen
Pauline,
you would have... darker sometimes more than...
Right.
other times,
But it's
don't
still
you?
brown, has it?
Yeah.
Okay,
Yeah.
so brown is... Okay, black sometimes means there's blood that's been altered that's mixed in with it, so it doesn't sound from your history like you've had that.
Yeah.
Okay, all right. And any weight loss?
Well, yes, I did, but I'm hoping to put it back on. I did put that down onto the thing.
Was it intentional weight loss?
No,
or
it
without
was
realising?
not. My sister died.
Right, gosh, okay.
But I don't know if I put it back on, but I was very pleased I put on this pound in a year.
Okay.
Whatever.
So you haven't put much weight on, but you'd lost it after quite a stressful time, hadn't you?
Yes, and then she's had cancer too.
Right. Okay.
Yeah, I've got the all clear in October, so
Okay.
it was all you know. It's all been quite stressful, probably the last 3 years, really. But it's all looking good now, you know.
Good. With this stomach, this acid problem that you're getting, though, is it okay if I examine your tummy?
What now?
Yeah.
Yeah,
And
no.
can we do a back passage examination as well?
Oh my goodness.
It involves inserting a gloved finger into the back passage to see if there's any blood or if we can feel anything abnormal there.
What's the date of birth, please?
So I get you to roll over to that side, but don't fall off the edge. Just be very careful.
Yeah. Oh, right up, isn't it?
And just bend your knees up as much as you can. That's fine. And I've got some cold gel on a gloved finger, so it's going to feel a little bit cold, but it should not feel painful. Okay.
Okay.
Okay, so I can see the pile there, sorry. Just deep breath in. Sorry about that.
Right.
Yep, so I can just see a pile and that's it. I'm going to wipe that gel off. And I'm going to leave some tissues there for you and you can get dressed and come and have a seat.
I wasn't expecting that.
Bin's just there.
Did you only see one pile? I thought I got...
Yes, there might be, I mean, you might have some further higher inside, but there's one that's sticking out a little bit, and that's probably the one that's bleeding because it looks red.
Yeah.
But there's nothing else abnormal from examining you, okay?
Oh.
Are you okay?
Yeah.
Okay. Now, sometimes when you're getting a lot of acid that's causing this heartburn symptom, it's because of a bacteria called H. pylori. Is that something you've heard of at all?
No, it isn't. No.
So this bacteria can cause the acid burning symptoms, and that bacteria can actually be eradicated altogether with 2 different types of antibiotics and one of these tablets that protects the stomach, like lansoprazole. To check for the bacteria, we can get you to do a poo sample and bring that into us. And if it shows that it does have it, we can eradicate it. And if it doesn't, we might need to send you for another camera test to have a look, because it's been many, many years, hasn't it?
It has.
Okay, so that's the form to bring back with this. Okay, so that's for you to take away with you, and then we'll be in touch about the results.
All right, thank you very much.
All right, take care then.
Thank you very much.
Bye-bye.
Thank you.
So how are you feeling since the discharge?
Overall, much better.
Okay.
They gave me the results straight away and said basically there wasn't anything wrong.
Yeah.
So I was pleased with that. Good.
Yeah.
So, how are you getting on?
All right. I had my first meal yesterday, my first poo.
All right, okay.
My legs were like jelly. She sent me to bed today on Friday, and Saturday, by mid-afternoon, it was all right again.
Your blood pressure is much better today. Don't know, you're very happy, I don't know. It's around 130/80 at the moment. Yeah, so that's good.
I'm good, thank you. I've got Kerry with me. It's Kerry's,
How are you?
Kerry's first day with us.
Hello.
So, how's this leg?
You're going to be in for a shock.
Am I? A good shock, I hope?
A good shock. A very good shock.
Oh, the cream's worked then, has it? Oh, good.
It's what you call lovely jubbly.
Excellent.
Oh, yes.
That's what we like to hear.
Oh, it's been bleeding. Gungy, gungy.
Let's give it a little clean.
It's been a while now, hasn't it, since I've had this?
Yeah.
Oh my, it's all gone.
Look at that.
Fantastic.
That's
Oh,
lovely.
that's brilliant. That cream is brilliant, isn't it?
Yeah.
Yeah, such good stuff. And it's even helped, even the ulcer, that's totally dried up and everything now. It almost
Yeah.
looks like normal skin.
I've still got all my bruises still. There's one there, look.
Wow. Oh, that's brilliant.
Lovely, isn't it?
So you've had a week of the cream now, haven't you?
Yes.
So what do you think? I mean, I think maybe just another few days of it. Yeah.
Well, it's looking lovely now.
Excellent. So I just need to give you a couple more pads then.
Okay, thank you.
They're the smaller ones, aren't they? I've got these ones here. So you've got an appointment on Thursday then?
I've got an appointment Thursday,
So
and
just
I've got
to
two
check
for next week. Yes, lovely, isn't it?
Isn't it?
Yes, I'm happy.
Good. So you've been partying all weekend again, like you did last weekend, or
No, this weekend.
You've had a
rest.
You've had
It's
a-
a 50th,
70th and then a 60th.
Yeah.
So
Yeah.
we had 3 on the trot. 50,
Yeah.
70, 60.
Yeah.
So you had a quiet weekend this one
Quiet
then?
weekend this
yeah.
weekend.
No more
3
partying.
weekends on the trots enough, thank you.
No more diet.
All right. Oh, well, I'm really pleased that that's getting better there, Jonathan. So.
Yes, thank you very much.
All right then. Take care. Take care. Bye-bye.
Lovely, thank you so much for your help.
It's okay. There you go.
Brilliant.
Take care.
Thank you.
Bye.
All right. Take care.